Hi there, everyone. This is Helenique, and I am sitting with one of the most interesting people I've met in the last while. In the last year, I met Anna, and she's with us today, actually in the Netherlands. And she's going to introduce herself. But before we hear from her, I wanted to just say a few things about why I consider her to be a woman of truth. Anna was at a conference that I was at, and I think, Anna, you were presenting before I was presenting, and I remember listening to your entire story, transfixed, just really connected to you, and I felt the presence and the truth with which you were bringing your message was really very, very powerful. And I was so inspired. I was taking photos. I was trying to remember slogans that you were saying, and we met afterwards and realized that we actually had a very interesting level of connection professionally as a doctor that you are and as a psychologist. I was looking for a certain way of understanding my research, and you really provided that. And that for me was also really instrumental, that you were so helpful and so kind, but also that you had a kind of genius intelligence, I consider, to be able to connect certain things for me that I hadn't had the privilege to hear from anyone else. So I considered this a very special meeting, and I'm very excited to have you here today. So welcome to Anna. Can you tell us a little bit about you and what you're doing, your title, so people know more about you?
Yeah, thank you for inviting me, Helenique, and for the kind words. Yeah, I would like to say something not about me, but what I'm passionate about at that particular moment. I think there are quite different passions in my life, but the last years I decided to turn something that has been developed from pain. From the idea came from not having opportunity to be helped, not having opportunity to be to understand why I had a certain physical, emotional experiences that were bothering me years ago, and finding a solution for myself by digging in the scientific literature from different disciplines to helping other people. And nowadays, from 2016, turning this as an online platform where the purpose is, by bringing it online, to be able to reach much more people. And the group of people I'm most passionate about are the people who suffer from very broad range of symptoms, but very often psychiatric symptoms. And they might even get a psychiatric medication and treatment, but they still are not helped. And they have this feeling there is something else that is going on that very often nobody understands. And unfortunately, still there is a lot of research done, but this knowledge that we built in the research is not did not reach yet, I might say, a lot of the professionals, medical professionals, certainly not the mental health professionals, who would see the connection between autoimmunity and psychiatric complaints. Me and the organization that I represent, Hashimoto Health, we're dealing and with really empowering people by bringing them information, really making them aware that if they're long-term, not one day that we just don't feel okay or our mood changes, but really in the long run, if you have psychiatric complaints, please look and take in consideration this may be related with autoimmunity that starts develop, because this is what is difficult with autoimmune disease in general, that they have a long trajectory of developing, and at the moment that we diagnose the disease, most of the cases the tissue or organ is already destroyed, so it's really sad. So our goal is really let people know this in advance, and preventively work on finding people who has a high chance to develop the disease as Hashimoto thyroiditis, and prevent during the interventions we offer.
Okay, so you're talking about Hashimoto?
Yeah.
And early diagnosis of it, so that people are not getting the diagnosis at a time where already an organ in their body is decomposing or degenerating so fast that you can't do anything for it. and you are very passionate about it, and you are actually a medical doctor, and you've turned your career towards this because you yourself went through a really great challenge, similar, right?
Yeah.
Okay, and so the challenge that you went through, would you say that that was one of the most significant challenges in your life, and that this is what you learned, that you wanted to really direct your attention to helping other people discover the disease earlier? Or would you like to name any other challenge in your life that was really like a kind of life-changing experience? This one sounds pretty much like that, but I wanted to give you the chance to also look back and say if there was anything else in your life that you consider to be a real breakthrough and that it changed the way you live your life. Sounds like one.
Yeah, you're right. But just to make one point, to say early diagnosis of Hashimoto would not be right, because what we're actually doing now this particular moment is we're really helping people to estimate the risk of getting the disease. So there you can intervene and prevent certain preventive interventions.
Okay.
And we're working on developing an early diagnostic tool, not by the means that nowadays is done, but by the use of the voice.
Okay.
So, but this is something really in development, and we're not yet there. So what we're this particular moment doing is for the group of people to estimate the risk to develop the disease and prevent developing the disease. And for those who have developed the disease and are already diagnosed with Hashimoto thyroiditis, due to the fact that there is no cure and treatment, people get certain medication that helps live their life. We're offering them online tools that they can use in order to get better quality of life, do the things they want to do in their life, not be stopped from their disease, and make sure that they don't get a second or the third autoimmune disease, but very often they go together. And go back to your question of life-changing experiences. Yeah, I think it's not one and not two in my life, but if I hear your question, the first what comes in my mind, and I think probably one of the most influential experience in my life is the death of my mother when I was 2.5. So yeah, you can think of this, and there were the circumstances also around of the people, the family, that it was not shared, so I could not understand what happened and at this age, and suddenly someone that's so essential in your life disappears. So this really has been probably one of the most painful experiences in my life. From the other side, it is very, if I look from the perspective of today, I am who I am today and what I'm doing due to this experience in my life, also in the way I dealt with it.
Yeah.
And funny enough, probably is other experience that's very close to motherhood and mother figure, the birth of my daughter. I would say turned me around and open up, heal the parts that were not yet completely healed. So I would say these two experiences are the most essential in my life till now.
Wow, I was very touched hearing about both of them, and I can really understand that. A lot of people advise and also experience that, like when you have a great loss, when you become a mother, there's something that's repaired somehow in that. Not to say that it's not really challenging as well throughout, but the death of your mother and the birth of your daughter were two very instrumental, life-changing experiences. What did you learn from them, do you think? Or what did they teach you? You said the first one reveals who you really are in your life because of that somehow, and the other one helped you heal. Is there anything that you want to add to that?
I think that the birth of my daughter was more, it was not like the healing part just, but I had this very irrational, deep fear, unconscious long time of becoming a mother. And it was very, very deep in me. So it was never a question that I want to have a child or that I want to become a mother without really deeply understanding what is behind it.
Okay.
And if I look now, it has been a deep fear because of illogical thinking of a child that mothers just die.
Got it. Yeah.
They don't. They are not there. So it's like being a mother means to be dead.
Yeah, like a deep fear that you
Yeah.
experience. I'm not sure what's going to happen when
Yeah.
Yeah.
So taking this very consciously taking this decision to become a mother and experience pregnancy. So not just the birth of my daughter, but also the whole process of becoming very consciously making a decision to have a child, and experiencing the life in me of her, and it has been transformative, but also very understanding of a part of me that still holded anger towards my mother. What might be for her to lose me?
Mm-hmm.
So it was not just about me, but it was more understanding the position of what might be if there is people believe in different things, but if the soul stays and lives in some way, what would have been the experience of my mother?
Mm-hmm.
To losing me, or to lose her husband, and to lose the family? What would be for her?
You, Anna, to think that.
Pardon?
There's such compassion in you to think that, even to be intrigued by that, to not worry so much, or to go beyond your own suffering and pain of that loss, and to think about how her loss would have been experienced, you know?
Yeah, it was an enriching experience, I'd say. Yeah, it just went. It was not something that I in some way thought how to.
Yeah.
Sort of made a plan how to. It revealed in this way for me. Yeah.
Just happened. Did you learn anything about that you think is a truth about life, or that shows you something about the world and the way the world is? About life?
Yeah, going back because you were saying also what I learned from the death of my mother, of course, a lot of things. But going back to my mission related to that, you know, there is no direct evidence, but we are now seeing the last year building in the research about early adverse events and how they really are programmed in our physiology, not just psychology, but really in our physiology, and how this leads to makes us opt to certain diseases. And one of those are autoimmune diseases, and the group of how this influences immunity. So I see a huge, how to say, it is not easy to, but not all the people want to hear that. And not because, so there is very often a protection layer. We are not ready at a certain moment to even think of that our parents or the people who take care of us and caregivers may play the role, because we're protected so long, this sort of shield of protection, and it is part of our ego. That's, but I would repeat, even though that people would not like me or they would disagree with me, I would like to repeat, and hopefully at the moment that people would be ready to hear, to know, we do have, it doesn't mean that if you have an early adverse event, you would get an autoimmune disease, but please have in mind, this may condition your immune system in a certain way that makes you very up to. Take care of that. Find a good professional who can guide you. Take care of this side, because, you know, it's not just the genetics. Of course, the genetics plays a role, but we know that some people had the genes, but they don't open up and they don't develop the disease. Why the others do? Does, you know? So that's we have to keep asking questions, and yeah, as I said, we see that more and more research is coming and evidence in this area, but still not directly related to, okay, my interest of the Hashimoto thyroiditis, but we see it in general that about effect on the immunity, there is no doubt.
Okay. You are such a great teacher, and standing so much in your own experience, your own truth, just radiating outwards to people, really a very strong message that actually I've heard a lot of people starting to consider, and a lot of people are talking about this now. And I think with a lot of cancer that women are experiencing, and a lot of physical suffering, despite being very physically active, despite being very in touch with emotion, despite whatever, there are many examples now of women who are struggling physically with their health, their hormones, different aspects. And then you bring in this subject as well to that conversation. And there are, you know, big questions and a lot of theories saying that we have to understand the whole psychological, physiological, environmental, circumstantial influences on a certain person throughout their life to really understand disease better and to really look at a more comprehensive etiology or understanding of what's really going on to make a woman predisposed or eventually end up with an illness. And I think it is very powerful what you're saying, and very important for women to really consider that, and then to know, like you said, there's this other component where we can actually change our DNA, but we do have to do a lot in order to make that happen, and it's not always a guarantee, and it may not even be your destiny, if there's such a way to even use that word now. That sometimes you have to work with both these realities, that you can take care of certain things, but you've also been exposed to certain traumatic events, and this may make you more vulnerable in the world, and this means you need to really consider that and take greater care. So it's a very important message, and I really hope we can put it out in different ways. And for your whole experience as a young child, then I can imagine it being, like you said, quite confusing and shocking that nobody spoke about the death of your mother. So this is one more question about the wisdom that you have now as a woman and how you would share it with a younger part of yourself. So if you were 8 years old and you were looking at that 8-year-old little girl that you were, and you know what you know now as a woman, what advice would you give her?
To play.
I hear that so often.
Yeah, that's this is a sad part that I often have to work with it daily, because I think it needs reminding.
Yeah.
Just play. Don't be busy to do things. Prove yourself.
Yeah.
I had to grow up at the moment mother died, and you are too young. I was just a child, and be there to play and be as any other child, be free and rely on the things that be stable and safe. But it was not. So I had to grow up very early. And so the biggest message to my 8-year-old child is just, I think, play, and that I would take care of you.
Beautiful. Somehow there is a large number of us that feel like we didn't have, or we didn't get encouraged enough, or we didn't feel like we could just be spontaneous, playful children, that there was kind of an innocence there that became very responsible very soon. I spoke to another lady from Cyprus, who also at a very young age felt very responsible. She's in the International Court of Justice now. So as an idea, as an example there, you can see that, somehow we end up having circumstances. For her, it was growing up in an island that was divided, Cyprus, and really being confused about that and nobody knowing how to answer that. So this constant struggle to understand it made her also want to be very responsible. And she missed out of that spontaneous play as a child. And I hear for you, you also had to grow up and become very responsible. So we really grow up, I think, with many different ideas about the world, ideas about ourselves, about men, about life, about work, that can sometimes be a bit deceiving. And so the next area to look at for me is to ask you, what lie do you think you've lived with in your life? That
What?
You lie, like
Lie.
Yeah, what have you believed about life that you realize now you've grown up, or you're this adult woman, and it's not really true? You've talked about a lot of different ones, actually.
Yeah, I became, this is the first thing, I became allergic to not telling the truth. And I still can react, even when people don't do it consciously, I can sense it. If I sense it, I can get the shivers, I find so important that we tell each other what it is.
Right.
Because I think even if it's painful, it is the best way to go further. It's like some people, I see how they react in the way I communicate, for example, with my daughter, out from the moment she's born. They said, yeah, but is this something you tell a child? Why this should be shared? I believe in that telling what it is there is the most important. And then, yeah, you have to be there for the child if the child needs you, if it is sad or upset or, but tell what it is or tell your truth.
Mm-hmm. Why do you think we struggle to do that?
For example, in my case, I think that my family, my mother died unexpectedly and she was very young. So it was a really big shock and a lot of pain for everyone in the family, to my father, my grandparents. If I look back, I think they didn't mean it evil. They just could not cope with their own pain.
Yes.
They didn't have a space where, gosh, if now the child is how to explain. They didn't have the skills or didn't know how to do it, I think also. But I think the most is they were very scared how they would deal with my own pain.
Mm-hmm. So are you saying that somehow the lie that, or the kind of deception that was created, that we just go on and we don't deal with this pain, that somehow that was like a way of going more into not the truth of the pain, in a way, something like this? So you
of course, there are a lot of reasons not to tell the truth, but I think in this particular situation, yes, I think that not be able to deal with yourself, not holding yourself, being afraid of your own experiences, of your behavior, what I might do or what someone else might do. So really feeling insecure.
Yes.
And of course, not telling the truth can be a manipulative experience, but I think very often in the intimate relationship, it is not. I think very often it's just a lot of pain and insecurity driven.
Yeah, that's great. It's very enlightening to think about it also like that. That sometimes we feel unable to share more of who we really are and what we're really feeling because we're not sure we'll be accepted. So kind of insecurity, or we don't feel safe, or we're just dealing with something in this way and we don't have another way to deal with it. So it might be a lot of pain and loss. It also makes us just try and cope, but we're not really coping. And admitting that and being truthful about that can be very, very hard for a lot of people for a long time. So it's really helpful that you highlight that. There's also a lot of discussion nowadays, a lot of groups forming, a lot of women taking more visible positions in society, a lot of research by women. A lot of things are happening in the realm of women becoming more active. And so I wanted to get a sense from you what you think about that and how you place or position yourself in that. Some people are saying there is really like a movement of feminine power and that there's a need for it in the world right now. And you yourself, what would you say? How do you see it at the moment?
I think there is a lot of talk about empowering women, empowerment. I don't like extremes in general, and this, if it is extreme, I also disagree. I think that women, you see that so after this feminist revolution in 60s, 70s, certainly they played a role. But if you look on history, women in the different moments of history played an extremely important role, and they had a powerful positions in different times. And I think awakening has been always there from the women in some way. The awakening has been always there in different point of history. What for me is important that women would be free to do what they would have a choice, not driven from sort of pushing or placing the restricting from the society or societal norms, but as people in general. But women also would be free to decide, am I going to work? Am I going to work full-time or not? What I'm going to do? If I want to stay at home, that would be also okay. If I want to stay at home and take care of my kids. So it's more the freedom to operate and to have a choice.
Yeah.
But I do agree with what you mentioned, that there is sort of need, and I think a woman, but it's more like a woman energy. And I think this can be a man also who comes from his female energy.
Absolutely, yeah.
So it does need to be a woman, in my opinion. It can be because we both genders have both inside us.
Mm-hmm.
I think it's more the caring and connecting part of us that we need nowadays.
Absolutely, I really agree with you, and I think those two qualities are the real benefit of this feminine quality or feminine principle getting much more respect and much more visibility in each of us and in our world, the way we work in our world, the way we love the planet, the way we take care of children, that we don't just always prefer the logic and the analytical thinking and the progress, that we're also thinking about our emotional intelligence and many other aspects of what we consider to be feminine qualities. And so really this kind of time is a time where you're seeing this kind of quality becoming stronger in the world, or do you think we still have quite a lot of work to do?
Oh, good question. Yeah.
And when you look at women and women's health, because I consider you somehow an expert on that, actually, because you have a very specific perspective on it, but you really are very much with your finger on the pulse for women and women's health, because as I've understood, Hashimoto is much more evident in women than in men. Is this right? Yeah.
Yeah, but autoimmunity disease is different. So every disease has a different profile. But in Hashimoto thyroiditis, indeed, 8% of are women that are.
What do you think about this? The fact that women are revealing or coming up with a lot of illnesses after being in the world working, after being mothers and trying to juggle the role of being a working mother, having a career, dealing with her own personal stuff, and also keeping the home. Do you think they're related? Do you think this kind of intention we have to be more active in the world and mothers at the same time, living in the world the way it is, do you think there's a relationship between those things?
Yeah, I think that there are a lot of theories and different ideas why women are more predisposed, and certainly hormonal things are playing a role in that. But if we look on societal and more environmental factors, I would say, yeah, I think that probably taking this to the responsibility women have and the pressure that women, yeah, we accept also to care. I think that it's not just a society you can place on women, but we accept to care. Yeah. Like we would say, okay, women are working, but how often the household duties are shared, you know? So it is women can work full time, but then the kids are still staying on women's role. Who is cooking? Who is who is shopping? Who is cleaning the house? So the list is going longer and longer. Yeah, you can say this is part of being feminine, being caring, but how we can be caring for others if we don't have time and capability to take care of ourselves. So I think that for sure this not being able to or easily losing our own ourselves in being in service of others. Yeah, that as a trend, I think that it is a sort of and having perfectionistic characteristics. This like doing the things really well, wanting to do the things very well.
Yeah, perfectionism is quite a common quality in women. I mean, I didn't notice it so much. I thought it was very specific people, but the more I'm speaking to many women now, I see a lot of us have an area of our life where we actually expect a lot from ourselves, like a lot, almost perfection as a standard.
Yeah.
Yeah. So something about that is also responding to the pressure of what we think we need to deliver or we think others need from us, maybe. I don't know.
Yeah, I have an observation that is still not backed up with a lot of really good research, but like we're talking about, and there is no question that we have this highly sensitive person. Mm-hmm. And this is being really open and receptive, which is wonderful, but it can make a havoc on people if you're not aware, and our relationships and our work relationship and the quality of life and the health. So what we do with that, and I have a feeling, and interviewing and talking with a lot of people with particularly Hashimoto thyroiditis, that this group of women have this open system that at certain moments really overstimulates, and it is indeed conditioning our response to stress, and can in the long run lead, of course, to high chance of development of autoimmune disease.
Okay, so to all the women watching, I want to make a quick summary and tell me if you agree. So we need to watch out for being really perfectionistic, expecting a lot from ourselves, and also make a note about the sensitivity. So if you yourself are very sensitive, or if you know people around you, women who are really sensitive, to also be aware of that, because that makes us a little bit more susceptible to, or we could be at a higher risk. Would you agree with that?
Yeah, and as we discussed earlier, be true to yourself and ask yourself, if I take this list of early adverse events, do are some that I can recognize in my own early years?
So let's say someone's watching, Anna, and they might want to engage deeper on these kinds of questions, and or they would like to know a bit more about autoimmunity, the risk that they might fall under. Maybe they're really not sure and they just want some more information. What would you suggest? How can they find out more about Hashimoto, and what can they expect to find? I think you have a website. I know that they can go to this website, www.hashimoto.help, and you spell that HASHIMOTO.help, right?
Yeah.
And they could go there, and then they could email you, maybe, or
yeah, and they can email to the info@hashimoto.help.
Okay.
Current website is informative, but it's not giving so much information, as we're preparing now the new version.
Okay.
When also the group of people who are experiencing certain psychiatric complaints, they would have an opportunity to fill in a certain quiz that give them an estimate of the risk, and giving them suggestions what they can do from there to prevent, if they're in the group of the high or middle chance of developing the disease, what they can do with that, and splitting our services and products and all the information available for people who already have the disease. So some patients, I think within 1.5 months, would have the new version. And yeah, for people who are interested, let's check again, and there would be a lot of information available there. And if there are any questions, yeah, please email us.
Okay, wonderful. And just to make that even clearer, when you speak about psychiatric complaints or psychiatric situations, conditions, maybe illnesses that they've had, can you just spell out a little bit more, so that someone watching, if they are vulnerable in this area, then they know that they might also get help from this website? So psychiatric conditions like?
What we see with the very early stages of the Hashimoto thyroiditis, the most often experienced psychiatric complaints is depression,
okay,
anxiety, and yeah, very often as diagnosed borderline personality disorder, unfortunately. So I would say the three, the most, if even if you are diagnosed, consider thinking and checking, because it's not a big deal enough. If you can just check the antibodies, if they're available blood in the serum, you would know if this plays also a role, because there is no one way. So you would know if it plays a role in your complaint.
Excellent, very clear. So if a woman is suffering from depression, anxiety, and or if she's been in sessions and there's been some queries or a proper diagnosis made that she has borderline personality disorder, I would understand that means that there are also traumatic events in her history and some difficulty around knowing some appropriate social behaviors, maybe even. in her way of creating relationships and intimacy. So if you are struggling with issues like that, and
self-criticism and
self-criticism,
high self-criticism, really, that's, you can see it, of course. This is one of the, you see it by people with depression, you know, but without being diagnosed with depression, if you know yourself in your chatter that bothers you a lot and you have a difficulty with your chatter, self-critical chatter, I would say, and health complaints, you know, that you have certain symptoms that bothers you on a long term. So think about it, consider, read, inform yourself more.
Okay, and then what they could do is go to the website. They could maybe fill in the quiz. If they had a question or two, they could maybe email, but there is some information there. And certainly by the time we share this video, I think the website will be really there to help people that are having these questions. So if there's a perfectionistic side, a critical side inside your inner voices, and if you maybe are also expecting quite a lot from yourself in life, if you've had traumatic experiences before, if you have had anxiety, depression, or borderline personality, and or if you really just want to know a little bit more about Anna and her cause, you can go to www.hashimoto.help. And there's also a few indicators, I think we've spoken before, of gynecological problems. So if women have had difficulty falling pregnant, there might also be an indicator there. So
miscarriages
miscarriage signs as well. But don't get too alarmed. First, go over to the website, interact a little bit over there, fill in your quiz, and see the risk factor. Because if you do catch it earlier, this is what we're saying, right, Anna? Then there's a lot more that can be done. And as we all know, even without this information and this interview, whenever you have had difficulties in your life, you are a little bit more vulnerable emotionally. And you need to work on that. So you need to take care of it, work with professionals that can really guide you, and get your self-care in your life really well covered, so that that's something you're doing regularly, that it's not just at crisis moments that you take time off and you rest. You need to have that in your life regularly. So this is what you're most passionate about in your life now, Anna. And so we're going to close with 3 powerful words, or 3 very meaningful words that you choose to name and tell us why you choose them, which are like gifts to the audience. So to anyone watching and to everyone else that doesn't see this video, these words are like wishes or prayers or reminders of 3 areas that you think are really important. Which words would you choose and why?
Strength, and power, and femininity.
Wonderful. And what does stand mean for you?
Yes, a tree, you know.
Beautiful.
Standing in your truth, you know, that's like, because 3 words, I'm thinking standing in your truth, femininity, you know. Stand really as a tree, knowing your truth, your own truth.
Yeah.
And of course there will be winds and storms, but stand as a tree.
Yeah.
And stand proud in your femininity.
Wonderful.
Because I think the femininity is carrying also vulnerability, and very often we make mistake thinking of vulnerability as something that we're fragile, that we are broken. I think that vulnerability is the strength. There's the biggest strength we care, as we dare to be vulnerable.
Absolutely, I really agree with you. So standing in the way a tree would stand, being powerful and truthful in that, and then to be able to also stand in your femininity, so that you are caring and coming from this place of vulnerability with strength. It's been really informative and very helpful and very inspiring to talk with you, and I really love your clarity and your precision and your commitment to the work that you're doing, but also that you are, in my mind, someone who's very considerate of how much evidence there is to say what you say. And I think that's a very undervalued quality, and we don't see it often. So it's really nice to have someone who wants to be very scientific about the facts. And we need that when it comes to getting very precise about, I think, very precarious, difficult subjects like this, like Hashimoto and autoimmune illnesses. So we wish you the best with that research. I think if there is anyone watching who wants to know more, as we've said, for your own personal life, but even if you're interested in supporting this cause, or if you want to support the whole awareness of Hashimoto, I think it's something that we need to learn more about, because I have heard some people discuss it, but very few people really know how susceptible they are. And because we are women talking to women, it's an important subject for us to be aware of, because there is a lot of infertility on our planet now, and a lot of struggling women trying to have children. And there could be something more there that needs attention. And then there is also a lot of depression and anxiety amongst us. And we do sometimes need to know if there is a deeper cause and address it. So very, very great day to you, Anna. I really wish you a wonderful continuation with Hashimoto.help. And thank you for your time.
Thank you for inviting me, and keep in touch, Melanie.
Well, I will. Thank you so much. Bye.
Bye.
Bye, everyone.